Perfect. Just kidding.
Oh, well, I have scoliosis, so every day is like a struggle, and I get a lot of tension and back pain up here because of my scoliosis, and then at work the stress doesn't help, and then in the winter my lower back hurts because I have a little bit of arthritis in it as well, so it's hard to get out of bed sometimes.
Got it.
It's like I'm an old lady and I'm not an old lady.
Yeah, and I mean, you're still young. You shouldn't feel like you're 80 years old, right?
Right. Yeah.
So it sounds like
a struggle.
It's a struggle. It sounds like it's affecting the little things, like sleeping. Right.
And then I feel like it triggers my anxiety sometimes. Because then when my back's really messed up, I'll get really bad anxiety and I start to shake and it's like uncontrollable. So I don't know if it's a nerve or anything like that.
How often does that happen?
Pretty often.
Yeah.
Yeah.
Do you always feel like you're like in go mode? Just
yes, I do.
A lot of that might have to do with your nervous system, specifically your autonomic nervous system. So it's that switch that we have, your sympathetic and parasympathetic. It's the go mode, rest mode. Sometimes people get stuck in go mode all the time, or they get stuck in rest mode all the time. And if you get stuck in either, it will turn off certain systems of other ones. So for example, if a lion's chasing you, you don't need to use your gut, right? You're not digesting things, so it'll turn off like motility. Vice versa, if you're too sluggish and slow, right, then other things aren't going to activate, like muscle strength. So we got to find the right balance where your system switches between the two. A lot of it is going to start here, because it sounds like this is very stressed.
Yes, it is.
Cool. A lot of it has to do with your upper cervical and those top two bones, which we're going to be adjusting. So it's about bringing balance to your body.
Sounds good. I'm ready.
Cool. Okay. Melissa, you work with kiddos, right?
Yes,
You're
I
a teacher?
do. Yes.
So, because they're so little, you're always having to go down to their level, flex down, right? Is that pretty stressful on your body?
Yes, it is.
Yeah? Where do you feel that stress more when you're working?
Right up here.
Okay. Yep. Shoulder trap area.
Yeah.
Let me have you look to the left. You look to the right. How do those two feel? Which one feels tougher? Or they feel
I would say they feel the same.
Okay. Tilt left. Tilt right. Well, which one feels tougher there?
The tilting to the left.
Tilting to the left felt weirder? Yeah, so you're getting this because of this scoliotic wave that you have in your thoracic spine, right? Your mid-back goes from right to left, and then your neck has to go left to right. So you have like this wiggle.
Like a snake?
Yeah, kind of. This spinal wiggle. So we need to kind of focus in on where that wiggle mostly comes up, which is this side here. And then because of the wiggle this way, your head wants to go this way, right? Feel that, right?
Yep.
If I do the opposite, it kind of feels weird, right?
Yeah, it does.
It's like we're forcing it.
Yeah.
So look down and then look up. Do those feel weird?
A little bit. Up is like a little more stressing than down.
Got it. And even with your posture, right? Your shoulders are really far forward, rounded out, head comes forward. So it's causing too much tension.
It is.
We're gonna do this real quick. We're just gonna go right into it. Alright, so this is your first adjustment, right?
Yes.
Oh, fun.
I'm a virgin chiropractic adjustment.
I love people's first adjustments. It's just great when I get to be a part of the experience. It's fun stuff. Relax your hands. Yeah, there you go. Perfect. Just kidding.
Oh, what the dude? Whoa.
I'm gonna give you a little fake out.
Good Lord. Oh, that felt like great, but weird.
It's a very odd feeling.
Oh man, now it feels like you gotta do the other side.
Oh, we are gonna do the other side for sure.
Cause like it feels totally different than what it did. Whoa, that's crazy.
So
yeah. It feels good in a like weird way.
Does it feel like things kind of just like dropped and let go?
Yes, it did. A lot of stress and tension. It did. I feel like I want to be all like.
Just loosey-goosey.
Yes. Mm-hmm.
So you have a great nap after
Oh
this.
my gosh, that's crazy.
That was good. I'm a little jealous. I need one of those.
So's my husband.
Let's get you in. Let's see.
Oh, I already heard that.
It's already moving. So that's a yes. That is your body telling me that needs to move. And Melissa's been having too many headaches. A couple times a week, right? Mm-hmm. They're pretty bad. It's gonna get in the way of you teaching, taking care of kiddos, so we need to knock them out.
Oh, gosh.
That was clean.
Oh, man. Now I feel even.
Let's go.
I can't stand you right now. It feels good. Oh,
This is so exciting for you.
I know. Shit. Oh, that was great.
It's like she's pissed at me, but she feels so good.
Yeah, I am. I don't know how to feel right now. Shit. Oh, man. That was like really 2 good cracks. Whoa, that was crazy.
That was great. Hey,
That was
for those
crazy.
Your first adjustments ever?
Yeah, that was crazy. Oh, I felt like I relieved a lot of tension. This side feels sore though.
That's it. So with this new movement, right? It's kind of like doing a new workout.
Yeah.
Your body's going to be a little sore, a little tender here and there, but
man,
hydrate, rest and recover. It's going to feel so good.
Okay.
Yeah? Feels
Yes.
good? Mm-hmm. Yeah, you've also had this state of stuckness for so long, because like how long has this been an issue for you?
For a few years already.
Yeah, way too long. And this is definitely not something that occurs in just a couple of years. It's like a long-standing issue, especially with how your neck is, because you do have this reversal here. So that's why on that left side, I targeted real low down here, right? And on the right side, targeted up here, right? So.
Okay. Man, I could turn my neck way more than I could before.
That's nicer?
Yeah.
Can you look at the x-rays now? Look at that.
Yeah, I don't have to turn my whole body to see them. Oh yeah, that's a lot better.
That's real good.
Yeah, that felt good.
Sweet. Let's keep going, because this is just...
Okay.
That's great. What I'm going to do is just reach out and touch your toes.
Oh, my chest popped.
Oh, we got some more movement there. Come back up. How does that feel in here?
It feels like I'm like stretching, but not as bad as it was before.
Okay. So bend down one more time. So go reach down to your toes again. Yeah, so you're getting a lot of kyphosis in through here. This right side's really high. Come back up. Oh, more pops.
No.
So we're not getting good motion, right? Natural motion. I want you to just melt into the table, take some breaths, take a load off. Let's see. Left leg, a little shorter, but then it gets longer. So that's telling me there's a possible fixation on this left side. This right side feels more fluid.
Yeah.
Left side feels more restricted. This one still doesn't feel great, but this one's fighting me. This side's really high, too high. This side dips down, so your body wants to kind of do this.
Yeah.
You're gonna hug this.
I'm probably gonna need to.
Yeah. It's for some moral support there.
Yeah.
Emotional support pillow. I gotta get a little stuffed animal so it makes it easier. Relax everything. Come down with me. I'm actually gonna do an open palm so it's easier for you. Oh, there it goes. A little bit more. Don't forget to breathe. Ooh, there's one.
Oh,
There's the rest.
Oh my gosh. Oh man. Oh,
That was good.
that was. This needs to be like way harder.
I'll have to get a bigger
man.
pillow for that.
Yeah. Dang, that was good. That was good.
That was clean.
Jeez.
Okay.
You're just enjoying this more than I am.
I am enjoying this. This is hilarious. I love to see people in relief. And I'm just gonna go through here. So this is now the top. It's where everybody has that little neck bump. Everybody has a bump there, but it can look worse because of your posture. And then we just give it a little nudge.
Sheesh. That was great.
Sounds relieving.
Yeah, it was. Now I feel like a noodle.
I love it. Because you were telling me you were having a lot of breathing problems.
Yes.
Right?
Yes.
Restriction.
Yeah, I feel like you opened up like a good airway right now.
Love that.
My sinuses are cleared.
And the sinus issues, how often do they happen?
Pretty often because I have a deviated septum.
Okay. I got something that could help. So I'm going to just hit some of the sinuses. So you have a couple here, a couple here.
Okay.
So they're like little rooms, right? Sometimes when you shake the room up, it can clear things out. So I'm going to go. Now breathe in through your nose and out through your nose.
That's way better. I can actually breathe through both sides now. Oh my gosh. I can really breathe way better.
Oh, you can stay there. Stay there.
Okay.
She's so excited now. She just wants to get out.
I'm like, okay, I'm ready to go home now.
But wait, there's more.
Oh no.
We just want to make sure that your body's functioning as a whole.
Okay.
Right?
Yes.
Yeah, we can break it down into pieces, but the body itself is like one system. So if we don't get all of it working together, it's not going to get better. A little bit more here.
Oh man.
That was clean.
Oh, my elbow feels way better.
You don't realize
I didn't realize my elbow was stressed.
Yeah, you don't realize things are stuck until they're unstuck.
Yeah, no kidding.
Let's see. That was good. That was real good. Look at that. You didn't think you were going to get your arms adjusted, huh?
No, or my fingers. Thanks.
You're welcome. Because, I mean, obviously all this has been getting in the way of your work, right?
Yeah.
Teaching the kiddos.
Oh yeah, definitely.
Does it get in the way of anything else, like your hobbies, your passions, family time?
Yeah, it does. Because I can't do so many things because I'm like either tired or I'm in pain.
Yeah, you're fatigued and just not feeling like yourself.
Yeah, sometimes I can't even walk up our stairs in our house because I feel like super tired or I feel too weak to walk up them.
Well, so what, with everything happening, what was your goal in coming here? Like, of course, getting rid of the pain, but is there anything else?
To try to get, like, everything the way it's supposed to be working. So that way I can kind of continue to keep it like that.
Yeah, it sounds like you want some balance. You want your day-to-day to feel normal.
Yes.
You want to feel like yourself.
Yeah, I feel like it is affecting my everyday life.
Yeah, because I mean, even just being in pain affects our mood,
Yeah, it does. I was telling my husband that I was like tired of being in pain. I just like every day it's something different. So.
Yeah, and it's not only stressful for us, but it's stressful for our loved ones because they see us in pain, and it's like they just want to help. So it can be like this cascading ripple effect that the dysfunction in your spine can bleed into your life.
Yeah, I didn't realize it can like affect everything else. I thought just only my body, but no, it affects other things too.
Well, let's bring that balance back. I feel like we have. You feeling good?
Yes, I am.
Good.
It feels like it wants to pop.
Mm-hmm. I agree.
Oh, jeez.
That was too good.
Oh my gosh.
Have you been having some low back issues as well, or is it just primarily stick to the top?
No, it's low back too.
Low back too, right?
Yeah, it is. Yeah. And sometimes my feet do hurt, like the bottoms of them.
Some plantar fasciitis, some instability, feet not moving good.
Ah, jeez.
Good. There was a little bit more. There you go. How's that feel?
Way better, because the bottoms were hurting and now it doesn't feel like they're hurting at all. And I can actually move them.
Feels fluid. Feels like you can actually move your toes.
Yes.
Right?
Yeah.
Yeah, balance is everything. I mean, even just stuck feet and an improper gait and short foot mechanic, which creates that little arch in your feet, is going to cause a lot of issues.
Yeah, that's where I get a lot of pain is in the arch.
Yeah.
Yeah.
Let me have you lift this leg up with a straight leg. So don't bend from the knee. Lift from the hip. Straight up. And down. I think we could do better. How about this one? Oh, that one actually gets a little higher. Which one felt harder for you though?
The right.
Right felt harder, huh?
Yeah.
We want to take out any tension from the spine. We want to open up the spine. Roll it. Put a little pressure.
Oh,
And
my
drop.
God. Jeez. Oh my gosh.
That was so good.
That was.
Oh, that's so good.
Jeez, that was.
Did that feel smooth? Did it feel weird?
It felt weird, but it also felt good at the same time. Like, I wasn't expecting it.
Yeah. A lot of times when you do have that restricted motion, especially with like lateral bend in the low back, it's because the facets jam up, and then if it doesn't move, it causes this like dysfunctional pattern. So, boom.
Yeah, it feels a lot better.
Yeah?
Yeah.
Yeah, right. We got a good spot. And then just nudge it.
Jeez. Just nudge it. That's not a nudge. Oh,
Well, if I tell you what I'm actually going to do,
I
then
know.
people are just going to go, "Grr."
oh, that was great.
Good, I'm done.
It like opened up my sinuses too.
It's like
Even more.
we put an input into your
Oh,
body,
my
and then it
gosh.
makes like this global change, which is really nice.
Oh yeah. I felt it like everywhere. That was great.
This is just going to be some nice spinal decompression. This will be the last step into getting you taller. Big breaths. In and out. Good. I'm going to do a little wave. We're going to do a little dance. Gotcha.
Oh, jeez. Freaking A, man. Sheesh. Oh, that's worse than when I let you do that thing to me.
Whoa, you pulling too?
Oh my gosh.
Where'd you feel that?
Like all up in here.
Yeah.
Yeah, it was
Okay.
good. And then in my lower back too.
Low back too? Good.
Oh yeah.
The majority of your postural problems, right, is the upper body because everything is going forward. You have that anterior head carriage, shoulders are rounding out,
Yep.
and then that stresses out the lower segments too. So, this is the balance that we're trying to bring. How's that feel?
Great. It
Yeah?
feels way better, yeah.
Feel smooth?
Yes.
And lift your right leg up high. Ooh, look at that. That was fast. That's good. How about this one? Whoa. That's too good. How's that feel?
Way better than it did before.
Yeah. All right. How's that feel?
Way better.
That's looking good. Turn left. Turn right. Ooh.
Oh my gosh, I can turn like... I can turn way more than I could before.
That's looking much more fluid, more range of motion.
Yes, definitely. Definitely, I can feel the difference already.
I'm gonna have you look down and I'm gonna have you look up.
Okay.
So boom and boom. Does that feel a little more fluid?
Yeah, like a lot more flexible. I'm able to do it easier than last time. I felt a little straining.
Yeah. Restricted, right? Let me stand up.
Okay.
And then you're gonna reach down, you're gonna touch your toes. See how that feels.
Oh, my chest bumped.
Boom.
Now I can actually like touch them without being like strained or anything.
Yeah, it doesn't feel as difficult.
No, it doesn't.
More fluid.
Yeah.
Let me have you walk around the table a little bit. Yeah, what's the biggest difference you notice?
My balance feels a little bit better. Like walking, and it just feels like it flows better than it did before when I was walking. I don't know, it's hard to explain.
And that's one of the things, right, is you want a more balance.
Yes, exactly. It feels way better. It does.
I love it.
Yeah, thank you. It
You're
feels
so
good.
welcome. This is what your body needs.
Yeah,
and
definitely.
We're just trying to impact your body in a way that it's going to be able to switch and go to that rest mode, right? So that you're not constantly in this hyper state of stress. And if you're always in the state of stress, your body's going to start to break things down. So if we work on your posture, we get you adjusted right, we give you the right tools and recommendations, exercises to keep your body strong, then there's no reason why you can't work without pain and can't live without pain.
Sounds good.
Yeah?
Yeah, it does.
Okay, high five.
Sounds good. And it was like way better. It was way better already.
That's amazing.
Yeah, thank you very much.
You're so welcome.
I was very skeptical and scared, but it feels a lot better. Yeah.
I love it.
Better.
There you go. No more, not scared anymore. It's easy, right?
Yeah, it is actually. If you just